I'm Dr. John Shim, and today I'd like to talk about why you may need to see a rheumatologist. As a spinal specialist and with my experience of thousands of surgeries, I see patients on a daily basis who have frustrations about their neck and back pains. The truth is very few of these folks actually would benefit from surgical management. But because of the desperation, they may seek a surgeon to see if there's an invasive option. As I've stated in several other videos, the only time surgery is necessary if there's a significant threat to life or an important bodily function. I know sometimes the pain can be very severe, but pain by itself is not the only reason you should pursue surgery. The source of the pain should be identified, and if the source of the pain has potential to cause serious problem and is amenable to a surgical solution, then surgery may be necessary, and sometimes even on an emergent basis. On the other hand, these folks who have back pain, but after workup there's no evidence of limb or life-threatening bodily function, are taking a significant amount of risk. In this situation, non-surgical options and further diagnostic testing may be necessary. To give an example, pain throughout the spine that rotates around may be a rheumatologic condition that would not benefit from surgery. Should there be somebody with significant pain, but without a defined, risky situation, spinal specialists may ask additional questions about other conditions such as joint pains, migrating areas of pains throughout the body, and family history of conditions such as rheumatoid arthritis. In this scenario, spinal specialists may refer you to a rheumatologist. Rheumatologists are very specialized physicians who understand that sometimes the person's own body may be the source of pain. To try to simplify the understanding, rheumatologists deal with complaints related to inflammation of the joints and tissues caused by the body abnormally reacting to their own tissue. For certain rheumatologic conditions, the body thinks its own tissues are foreign and therefore may need to be removed or isolated. The body basically attacks its own tissues. The rheumatologist will perform a detailed physical examination, then use various laboratory tests to determine if you have one of these conditions. Rheumatologists have a significant number of medications that can help alleviate or reduce the pains associated with this condition. Rheumatologists can help people with neck and back pain from these various disease conditions. Rheumatologists can work together with an orthopedic surgeon to determine treatment options for these conditions. At times, the conditions may deteriorate to the point surgery may be necessary. On the other hand, with various treatment options, including medications, it's possible the rheumatologist may have an effective treatment for certain pains that may suggest a spine-specific condition. As always, I remind patients that when a surgeon recommends further non-surgical options or consultation with other non-surgical specialists, it is because the surgeon has determined that there wasn't a current need for urgent surgery and the current risk of surgery may not outweigh the potential benefits. Also, if there's concerns that the condition will not improve with surgery, a prudent surgeon will always recommend against surgery at that time. If a spinal specialist recommends a rheumatologic evaluation, I would certainly encourage that person to see such a doctor. As I always say, I'm not telling you what to do. As your consultant, I can only recommend what I would do. This is Dr. John Shim talking about why a spinal specialist may recommend a rheumatology evaluation. I hope you learned something in this video.